Hey, we're back, folks. I'm your host, BKP. Good morning from Circuit World here in Blue Ridge, Georgia. It's a beautiful day. Oh, hi, Dr. Raymond Tidman. How are you today?
Good morning. How are you?
Good to see you. There's so many things on the list is so long of what we love about getting the opportunity to live up here. But you look out there and see that nice little fog coming out of the mountains. When you get that view and you can see that in the mornings up here, isn't that just amazing?
Mountains and the spring rain.
Isn't that amazing?
Yeah.
Good morning. It's time for our segment, Ask the Doc. We have Dr. Raymond Tidman with us today. We want to thank the Georgia Cancer Specialist affiliated with Northside Hospital for this segment. Now, we have an enormous amount of questions, which I appreciate and we appreciate. If you ever want to send a question, you send it to info@fetchyournews.com, info@fetchyournews.com throughout the week. Now, we're not going to say, we're going to be nice. You understand?
Yeah.
And we love him. We agree. But we have so many questions you can't give Dr. Whaley. You can't give Dr. Whaley answers.
Okay.
You understand?
Okay.
Now, we love you out there if you're watching. We have a lot of fun.
I'll be terse.
Okay. You be whatever you want to be. Okay. I'm sorry. Let's start here. Don't have my glasses. I have a pinched nerve in my hip. The hospital said that's what it was, but my entire leg is going numb when I try to walk for more than 20 minutes. Should I be concerned, or is there just a part of is it just a part of the pinched nerve?
So let me digress by.
No, wait a minute. I need to answer. Are you comfortable?
I'm good.
Okay,
good.
Just checking. That's a nice couch.
It's a nice couch. I appreciate.
I apologize.
Appreciate your new digs here.
Okay, so back to the pinched nerve.
So just to go over the anatomy, the spinal cord connects to the brain and has spinal nerves that go out and run to their various places in the body. Wherever they run is where you experience the pain if one of them is pinched. So a lot of people will present to the office with low back pain. It's obviously that the pain is occurring in the back, but others come in with referred pain or just pain wherever the distribution of the nerve is. And most likely this individual is having a low back or an LS spine injury or compressed disc or something that's on one nerve. And it's not her hip at all that's really hurting. Luckily for her, in that it is isolated and very specific, it is probably very treatable.
So, let's say, I feel like my hip is hurting. That actually could be caused by
from the back.
From the back. Yeah. Okay, and that could be the answer for the entire leg feeling numb.
Right.
Okay, so it's treatable.
It
could be treatable.
It could be treatable. You do physical therapy. You take anti-inflammatory medicines, muscle relaxers. Those are easy things that are, low cost, low risk. If those don't help, then a neurosurgery consult for her would be worthwhile.
Okay, now this is one that comes up every week, and we're going to, especially living in the region here in North Georgia, and it comes up every week, over and over. But we're going to ask it again because it's a little different. Why are allergies and pollen so much worse this year than recent years? In recent years, it didn't. This viewer said it didn't seem as bad. Why is it so much worse?
So this is a good point to narrow down each of our perceptions. Probably what this individual is allergic to is real bad this year. On any given year, they do pollen counts, and you can compare them season to season, year to year, and actually get a number of how bad the pollen is. But for her or him, whatever they're experiencing, in that they experience it really severe, it may be that particular plant bloomed on a particularly good set of days that just got all over them.
So from year to year, you may feel personally that this year your allergies is worse than previous years, but it could just be the specific thing you're allergic to is the higher count this year than in the past.
Of that plant species.
Because, let me ask you, let me follow up on that. Do we sometimes, with allergies, just go to pollen and just say, our allergies, and pollen is like a catch-all, but there are so many things you could be allergic to that have a higher count of this and a higher count of that.
Yeah, so that's a very good point. They do total pollen counts, and many parts of the country, to get to 100 would be high, and we get over 1,000. So our pollen counts are very high, but it's not the total count that matters, it's the specific pollen that you are allergic to.
Right.
So some people may be allergic to dogwood blossoms, and others to a specific grass, or others to a specific flower. And if those are in abundance or blooming at a time where the pollen's really being spread around easily, then they're going to feel those symptoms. Maybe you're lucky and this year it rained on every day that your plant was blooming. Rain takes the pollen out. You don't have much of an allergy this year. So it's not the total count that matters, it's what's going on.
But it's what you're allergic to could be higher this year, and also pollen, I don't want to say is a catch-all, but it boxes everything in.
Yeah.
And we did learn right here on this show that we live in the OPEC of pollen, right? We won't forget that. The OPEC of pollen. Okay, over the weekend, my 7-year-old son developed a small red dot marks on his lower arm and back. The next morning, these areas, as well as the tops of his feet and his stomach, had red pink irritation rash on them. Could this have been an allergic reaction to food? He has never had a food allergy before.
So I need a little bit more information, like the child's age and other exposures, but generally, it's not an allergy. Maybe a viral, what we call a viral exanthin, could be a chickenpox. So when a blotchy generalized rash that's just itchy occurs, we think allergy. But from what she's describing, this child needs to see their family doctor or their pediatrician.
Okay, moving right along. This is an interesting question, because sometimes some of us all struggle with this, and there could be underlying conditions. If I have constant fatigue, can it be an underlying or more serious condition? Constant fatigue.
Constant or chronic fatigue is what I call waste paper basket diagnosis. So what do I mean by that? There are many causes of fatigue, including psychosocial things, just exhaustion from your current living situation or relationships. Finding out or figuring out what is causing fatigue requires a lot of testing and time. Generally, when there is no organic reason found, like low thyroid or anemia or other conditions, hormonal conditions, if there's no diagnosis found, then the patient gets labeled as chronic fatigue syndrome. Basically, it'd be better to be said, we don't know. It's not that the patient's not suffering, we don't know what's causing it, and therefore we don't know how to answer it.
So, but constant fatigue, it could be something underlying for...
Oh, absolutely, could be many medical conditions. I mean, the most alarming would be anemia. If you're anemic, there's a reason why you're anemic. Either you're malnourished or you're losing blood. Losing blood, it could be cancer. So chronic fatigue, it's not one of those things to be real tough about. I would get a workup. But if you get the diagnosis of chronic fatigue, you're kind of stuck, because that means there's really no answer.
Well, I was going to follow up on something on that, but let me move along, see what kind of time we have. Is it possible to have symptoms of appendicitis before a serious attack?
Hopefully, yes.
Yeah, I'm interested in this because I need everything else. I come to you this morning no longer with a gallbladder, appendix, so I need everything.
Missing a few parts.
Yeah, need everything else. But I'm interested in the answer to this because is it possible, being redundant here, is it possible to have symptoms of appendicitis before the serious attack? And I want to know that because I went through that.
Yeah, so a patient presenting with appendicitis may or may not have localized pain in the area of their appendix. More likely, they're going to present with pain around their navel or just generally in their stomach. So they don't know that it's right lower quadrant yet. They're just coming in, I got a bellyache. Maybe they have a little fever. Once the doctor gets them in and he starts poking and prodding a little bit, finds out that they've got a little bit of what we call rebound, that is just letting go of the stomach makes you hurt. Or as you hear as they drove into the doctor's office, they hit a bump and it hurt their stomach. Then that's a sign of what we call peritonitis. That means that the appendix is starting to leak and the infection is getting into the general area around it. Now you're starting to get dangerous. The rule of thumb for, I think, the general public is if you have a stomach ache and it comes on hard and you lose your appetite, you like pizza and you won't eat pizza, go to the doctor. Because it's far better for a doctor to take out a normal appendix occasionally than miss a ruptured appendix, which can become life-threatening. So, generally if we're reviewing cases in the hospital and there's an occasional normal appendix taken out, that's not a big deal. Mistakes happen, but you'd much rather err on the side of taking something out that could have been deadly than to leave it alone.
I went to work. So I'm supposed to write this. I went to work that beautiful summer morning.
Yeah.
All right. So we're in there. We're already on the job by 7 o'clock, and we're working away. And at this time, I'm working construction. I think I'm about 26. And all day long, it started like at 10 o'clock. I felt like every time I bent over, because we're working construction, something was tearing, just a little tear. It kept feeling worse, like something inside. So the guy I'm working with, I'll never forget, I said, Joe, something's wrong, okay? Something's wrong. So we got in the afternoon, went out to lunch, we got a bottle of Maalox.
Didn't help.
No. So later in the afternoon, it's about 3:30, and I looked at Joe as the guy I was working with, another guy. I looked at Joe and I said, Joe, we got to load up. And he knew something was wrong because he didn't hear that from me, because I believed you're supposed to go 7 to 7.
Yeah.
I didn't like anybody quit before 7. We went 7 to 7. That's true, all right? 3 o'clock, he said, son, you must be dying. I said, we got to load up. Something's wrong. Something is wrong, okay? It was a different kind of pain. It felt. So I go home, and I drink some Maalox, and it comes back up like it's fire red. So I said to my wife, I said, something's wrong. We got to go to the hospital. So we go over there, and I go in, and somebody comes in, a guy much like yourself that day, might have been you, and they pushed on me a couple times, and well, it's actually in Phillipsburg, New Jersey. Did I say that out loud?
New Jersey.
Yeah. All right. So I was in Phillipsburg, New Jersey, and they're pushing on me a little bit. So I've never had a surgery, first one, so they send me down to an X-ray. I mean, all this is happening like this. Next thing I know, this lady says, "Oh, comes in and says, oh, we're gonna, have to take your appendix out." So I'm, okay, it's Tuesday, Thursday at 3 in the afternoon? I mean, what do we schedule? No, we're going down the hall now. You're signing this paper, we're going now, because you've got about 15 minutes, and you do not want me to explain what happens if this bursts. Yeah. So, I mean, I'm going to just say off the top of my head, let's see, I'm 29 now, I was 26 then. It was only 3 years ago, but trying to remember, it just seemed like I was not an hour and a half. I was wheeling down because this thing had. So what I'm getting to, there is a point with me every once in a while. Mm-hmm. Is one, it's not that bad, and two, it is dangerous if it bursts. Can you elaborate a little bit on that?
Yeah, the point is that the appendix is this little appendage that's hanging off the colon that gets an infection in it, and that infection is festering, and that's when you first start having symptoms. And depending upon how mild or how it's tucked in there, it depends on where that pain might occur. That's all contained. It's all still in the bowel. You go in there and take that appendix out, there's no infection in the rest of the bowel. Once that appendix ruptures, then you've got infection and white blood cells going throughout the abdominal cavity. And that's a much bigger cleanup job and much worse future infection risk, scarring risk, adhesion risk. It's a bigger deal.
What is the procedure of cleaning?
So they go in there and they rinse the cavity with various fluids and antibiotics. and just make sure there are no pus pockets or areas where there's infection that has settled down into a lower spot.
Well, you know, I will tell you this. Now, I did mention earlier I'm missing a gallbladder, right?
Right.
Now, that attack happened in the middle of the night, and I know I'm about to get in trouble for this, but I thought I was dying. I did. In the middle of the night, I said goodbye to everybody.
Well, gallbladder.
It was over. I said goodbye. Yeah. I thought, I'm telling you.
Some people think they're having a heart attack.
Oh, I did. No, I did.
That's happened to me.
Yeah, I did.
It's like a heart attack.
I did, and
Well, now that we're telling medical stories, I've got one for you.
okay, go ahead.
So there was this couple.
Oh no! All right, let's get ready.
There was this couple, and the husband was not very energetic. Let's just put it that way. And in the restroom, in the bathroom, there was a commode seat that was kind of gnarly. It's getting a little bit flaky, and the wife was kind of on him. You know, would you whitewash that thing? Would you paint that commode seat because it's really looking bad? Well, he just never got around to it. So one day she got really frustrated and she painted it. Well, he didn't know she painted it, and he went in there to do his stuff, sat down, he got stuck. So he's screaming and yelling for help and everything. His wife finally hears him, and she comes up. She says, "What's going on in there?" And he goes, "I'm stuck to this commode seat." She goes, well, she opens the door and comes in there, and she goes, tries to get him off, pulls on him, tugs on him, can't get him off, and he says, "Pull the pin out. We'll go to the doctor's office." She goes, "Okay, that's a good idea. We'll go to the doctor's office." So she gets him out in the truck, somehow gets him up in the back of the truck. I'm not quite sure how, because he couldn't sit in the cab,
Right.
you know. Throws a blanket over it, drives to the doctor's office.
Commode seat attached.
Yeah, commode seat attached. You know, he's kind of on his hands and knees, and so she goes and gets the doctor, and he graciously comes out, takes a look at it, and she looks at him, and she says, "Doc, you ever seen anything like that in your life?" He looks at her, she says, "Yeah, pretty much every day, but I've never seen it framed like that."
Never seen a frame like that. No, it's just I see that every day, just never framed up. Okay, you know, getting back to my gallbladder.
Something more serious.
No. You know, when I had my appendix removed, they, you know, it was like I thought, well, can we schedule this? You know, I thought you scheduled the operating room and you had to call people in, and like, no, you're going now because. So when I went over and I finally had gallbladder surgery, doctor come in, he says, "Well, we can do it Thursday." This was Monday. Now we're scheduling it. Well, we can do it Thursday at like 10 o'clock. I guess this was gallbladder day. You know, they lined them up and run them through there, whatever. Okay. And so he said we could do it Thursday at whatever. And this was at, you know, where the gallbladder. It's interesting. Okay. You may, now the appendix is Phillipsburg, New Jersey, but the gallbladder is Baptist Hospital in Winston-Salem. You know where Baptist
Yeah.
All right. So that's, I remember everywhere I've been. Okay. Oh, when I had knee surgery, that was Rutgers University Hospital in New Brunswick, New Jersey.
You're a very diverse chart.
Yes.
Yeah.
So anyhow, getting back to the gallbladder surgery. So, so the doctor says to me, he says, "We do it Thursday at 10." And I said, "No, we're doing it Friday." And he said, "No, we're doing it Thursday." He said, "I have, sir." I said, "Why?" He said, "I play golf on Fridays." And I said, "No, we're doing it Friday." He said, "Why do you demand that I have to do it Friday?" I said, "Because I have to be back at work Monday. I only want one day off." Guess when we did the surgery?
Thursday.
No, Friday at 10.
Okay.
Yeah, so I could be back to work Monday. Anyhow, you have anything else besides the a keister that was framed with a commode seat? You want to close? You got another closer? You got anything else?
I'm tapped out.
We want to thank Dr. Raymond Tidman for being with us today with this segment of Ask the Doc from the Georgia Cancer Specialist, and it is affiliated with Northside Hospital. So we appreciate Northside Hospital for this segment. I don't know if Dr. Whaley will be back next week. The guy has got like 8 trillion frequent flyer miles. So, you know, it wouldn't shock me to see the peace agreement and him come back and say he was the official doctor on the trip or something. You know, I know the guy. I mean, I know. I'm telling you, you just don't know.
We'll look for him in the crowd,
right?
Yeah.
You just don't know with this guy. So we don't know next week, but we thank Dr. Raymond Tidman. If you have a question for Ask the Doc, you send that to info, I-N-F-O, at fetchyournews.com, and we will get it to the doctor throughout the week and get it answered right here on the show. I think that's it.
Very good.
All right. I have another surgery for you next week if you're back. Take us a break, Amanda.